So next week at the end of the lecture, we're going to do a test review.
Mm-hmm.
You need to focus on what I'm talking about in the review.
Okay.
And let me tell you, the Kahoot questions, you guys should just memorize them as fast as you possibly can when they're up there. The lecture questions we have, obviously my notes are a little bit, my slides are a bit different than yours. There's a reason for that. Those are typically on the exam, if not something similar. So in my viewpoint, there is no excuse. If you guys got it, the question in class or on a Kahoot and you're getting it wrong on the exam, I cannot help you with that. Other than that, just listen to the review.
Okay.
For this stuff, I really, really concentrate on. Today we're going to be talking about anemia and all the different types of anemia. Anemias, you need to know the differences between the three, okay? Or both, sorry. Any questions on the bone marrow? What it does, what it likes to do, what happens when it doesn't work?
Is that all we need to know on that slide?
You don't need to know anything about the slide, it's just the breakdown. Unless you really have a question on, where blood clotting comes from platelets, which is on.
Okay.
It's just the breakdown of bone marrow. Okay, the components, your three components of plasma. Again, you don't need to know this stuff, but sometimes if you're studying something, going back to your anatomy and patho slides can help you understand it. That's why they're there. I do not typically ask you a patho question. You had patho with Mr. Dave, who teaches it a lot better than I could. So I'm not going to teach it again. Platelets, we need to know about platelets. What do platelets do? Oh my gosh, yes. So what happens when platelets don't want to work?
You're not clotting, you're bleeding.
Say it again, Teresa.
You're not clotting and you're bleeding.
All right, so what are signs and symptoms of excessive bleeding?
You're bleeding.
And not just bleeding, because it's not always outward.
Blood pressure will drop.
Blood pressure is going to drop. Where's it going to go with your heart rate?
It's going to increase.
Going to go up. What is a normal platelet count?
150,000.
Yes? Yep. 2?
Is this 450?
400,000. 150,000 to 400,000. Trish, what was your patient's platelet count on Monday?
Oh, hers was 1.8 or something? No. I'm trying to remember. I remember her
The guy.
INR was 1.8.
You had the guy.
Oh, his.
Yes.
Yeah, his was 1.8 for INR, and then his platelet count was 40?
40. He was almost at critical. He wasn't quite there, but he was going to have a thoracentesis done, and they had to cancel it.
How is 40 not critical for one?
30 is, she said that.
We'll get there. 30 is critical. 40 is not. We'll get there. Don't worry. Don't jump ahead yet. Her patient was scheduled to have a thoracentesis. I don't know a surgeon in the world that will cut a patient open unless their platelet counts is well over 50,000. Because there's absolutely zero way to control the bleeding if it's below 50,000. But no, it is not critical yet. All right. What is hemostasis?
It's like homeostasis, but for blood.
Exactly. It's a vascular response. You get a cut, you get a paper cut. Those are awful, horrible, horrible things. And it's the body's reaction to a cut. It's the body's reaction to a wound. It's the body's reaction to getting cut open to have surgery or something done. It's the platelet plug formation. So what is an outward example of a platelet plug formation?
A scab?
A scab. Perfect. This is the both pathways. You guys can look at it. If you want to go memorize the intrinsic factors, knock yourself out. I don't know them by heart, so I don't write a test question on them, okay? All right, the system itself. These are the 5 activations of the system itself. Again, you don't need to know that. So, what you do need to know, spleen. What is your spleen and what does it do?
Highly vascular.
Say it again.
Highly vascular.
Highly vascular, absolutely. What does it do? What is the function of the spleen?
Filters blood.
Say it again.
Filters blood.
Filters blood. Good.
That's what I said.
This is what you said.
Stores blood.
It does store blood.
Filtration, oh, you already said that.
It removes old and damaged RBCs. It's a big deal. filters out bacteria. One of the big things it does that people don't seem to realize is it returns the iron content of those cells it's taking out back to your bone marrow. It just doesn't get rid of it. It recycles the iron from the cells back into the bone marrow to be reused. Right, anemia. Many different causes of anemia. Don't Google what causes anemia, it'll tell you have blood cancer, okay? Chances that you have blood cancer from anemia are slim to none. So what is anemia itself?
Deficiency.
Of?
Iron. Well, it depends.
It
A blood
depends.
component.
Depends on what's sufficient. What is a normal RBC count, red blood cell count?
For a male or a female?
Nope, it's the same for, RBCs are the same for males and females. It's the hemoglobin hematocrit that's different. Red blood cell normal count is 4.7 to 6.1. What's your normal white blood cell count?
Four point five?
Yep, yep.
Can you say that again?
4.5 to 11.5, roughly. Hemoglobin for females is 12 to 16. Hemoglobin for males is 14 to 18. Hematocrit for females is 35 to 45. And hematocrit for males is 38 to 50. Bless you.
What was the female again?
Female hematocrit, 35 to 45. Everybody got those. You're going to need to know those. All right. The clinical manifestations of anemia itself. You get your clinical manifestations from the body's response to hypoxia. Why is your body responding to hypoxia? If you're anemic, are you having problems breathing?
You having problems carrying the oxygen?
Yes. Probably breathing fine. The body has less transportation of oxygen. So what does the body look like? What does your person look like? Cold, pale. Tired.
Short of breath.
Can be short of breath. If it's severe enough, they'll be short of breath.
They look like that.
So severe anemia is anything with a hemoglobin less than 6. That's both in males and females. That is typically when you're going to see the shortness of breath.
You said hemoglobin less than 6?
Yes, ma'am. This is when you're going to get the heart palpitations, the chest pain, the shortness of breath, the heart attack, the fainting. This is when you're going to see that, when it's so severe that the body's starting to shut down, okay? Anemia in older adults. It does change the concept a little bit because an older adult, which is depicted 65 and older, but it can vary a little bit, having a lower hemoglobin, hematocrit, RBC, and WBC is completely normal. And they're fine. Their body doesn't need as much at that point in time in their life, okay? They're not growing. They're not of reproductive age, so their body doesn't need as much support. So what's a normal white blood cell count?
150 to 400,000.
white blood cell count?
4.5. Oh, okay.
So 11?
That would be leukemia counts.
I thought they said platelet count.
That's okay. White blood cell count. So well, I'm sorry, what's the normal white blood cell count?
4.5 to 11.5.
So if you had someone with a 3.9 and they were like 70, it's not something to be concerned about, okay? Now all of a sudden if it's like 1, something's going on. But if it's a little bit lower, it's not something to be concerned about. All right, erythrocyte production. Lifespan of an RBC is how many days?
120.
Good job. What are the 3 alterations that decrease RBC count?
Decreased hemoglobin synthesis.
Wait, what does that mean?
There's some
Not enough
leukemia.
hemoglobin.
Something is not being made because you have multiple different components when it comes to those RBCs. Something is not being made in order to make it a whole cell. So it's missing a folic acid component. It's missing a 12B component. All right? Great. What's the second one?
Defective DNA synthesis in red blood cells.
Yeah, so this is genetics. There's not a whole lot we can do about genetics, okay? And what's the last one?
Diminished availability of leukocyte
Precursors. Something's going on in the pancreas that the precursors are not being made, okay? Usually that's nothing good, by the way. So let's talk about the most common iron deficiency anemia. This is a ridiculously common thing in our country. It's common all over the world. It's more common in females than males. Should be a pretty obvious reason why, okay? Iron is present in all RBCs, in hemoglobin, and stores form, okay? So what is going on when you don't have a high enough iron content in your RBCs? You have enough RBCs. Don't get it confused. If you have 250 RBCs hanging around, you have enough RBCs, you don't have the iron count in the RBCs for it to do a job effectively. So what does the pancreas try to do to compensate?
Overproduces?
It produces more RBCs. Well, now what are you under risk for? You have more red blood cells hanging out than you should have there. Yeah, they like to hang out together. So you have a higher clotting content, okay?
Would that mean that the person bruises easily?
Can be. So thankfully, it is the most common anemia, but guess what? It's the most easily treated. So etiology. Other than women and their menstrual cycle and pregnancies, because when you're pregnant, if you haven't been pregnant, if you ever become pregnant, your little child likes to steal everything out of your body. I got my first cavity right after I was pregnant because my child was stealing calcium out of my teeth. The baby will take what it needs and it will take it right from your bone marrow. Like it just sucks it. That's why my husband called my daughter a little parasite.
What'd you say?
Because
She's
babies
a
are
selfish.
babies are selfish.
My husband and me called Isabel a little parasite. Yep. It's true. Look up the definition of parasite. Okay. She's a cute little parasite though. All right. All right. Clinical manifestations of iron deficiency anemia. What do you think the most common one is? The one that we hear about all the time in the United States?
Fatigue and tired.
Oh, I'm so tired. Everyone always blames their thyroid, by the way. Oh, I'm tired. It's my thyroid. Probably not, but all right, let's go there. Okay. Typically, it is from an iron deficiency anemia. What are some easy ways you can get more iron in your daily life?
Supplements.
Supplement, and what's the other one before y'all go pill popping?
Diet.
What foods are higher in iron content?
Right, greens.
Green, leafy greens, everybody's favorite, right?
Pronounced spinach. Spinach.
Change the
Spinach, what else?
I'm recording this conversation.
There's a lot more than just that.
Doesn't fish have iron?
Red meat does. Fish
Oh,
oil.
red meat, I heard it, red meat.
Oh.
Everybody's so afraid of red meat, guys, there's nothing wrong with red meat.
Nothing wrong with
Everything's
rice,
okay in
just to say.
moderation.
Yeah, I mean, I'm not saying sit down and have a T-bone every night, but
Too late, you already said it.
I already said it, sorry, I already implied it. Great, I'm in trouble now. But absolutely, meats, chicken, red meats, fish. Red meats have the most, but there's absolutely nothing wrong with that, okay?
Did you say fish?
What, fish? Yeah,
Yeah.
not as high as red meat though.
They have a lot of omega-3.
It'll help your brain.
That's what fish has, it's
Yeah.
omega-3.
It'll help your brain health. All right, diagnostic test. What is the easiest way we find out if someone's anemic? We just do labs. We just do a complete count and see what their H and H is, their red blood cell count, reticulocyte count, iron count is, platelet count. It's really easy. If they are low and it's not a diet thing, like it's not just okay, it's a little bit low, you need to do a supplement or increase your iron on your daily diet, then we have to figure out where it's coming from, right? So one of the things we like to do in the ER a lot when we think something's going on is we'll just do a stool test. We can do it right at the bedside. They go to the bathroom, they have a BM, we wipe a smear on, it will tell us if there's any blood in it. It's quick, it's easy, it's very effective. If they do have blood come back in their stool, then we typically have to find out where they're bleeding from, so we do an upper and lower GI. Everybody know what upper and lower GI means? It means the little tube that goes down the throat, and then the big old tube that goes up the rectum. And it is very large. Large. Anybody else been in a GI procedure yet? It's a very large tube. Okay? That make sense?
Mm-hmm.
All right. So if you wanted to increase somebody's daily diet, what are some things they could make at home? You guys said meat, you said leafy greens, what are some other stuff?
A protein shake.
Protein shake. What other foods are high in protein? If you're high in protein, you're high in iron.
Beans.
Beans,
Mushrooms.
mushrooms,
Nuts.
eggs.
Almonds.
You can make like the best omelet ever and get your entire iron count for the day in one meal.
Low in calories.
Yes.
If it's egg white.
Okay. Whole wheat toast. I know a lot of people aren't as much as going into whole wheat because they're like, oh, it's gluten, that's fine, but you know, someone wants a piece of toast, there needs to be whole wheat. And not just the white bread that was turned brown, no, actually like whole wheat, okay? All right, drug therapy. So when it comes to iron count, you can just go to any store, Walgreens, Walmart, whatever, and just get an iron supplement. They're all the same. They all have to pass the same FDA regulations to get on the shelf, all right? If it's really bad, or if it's somebody that has a pancreatic disease process or cancer, they're fighting something, we can do IM shots of iron, or we do have bags of iron. I think someone in my group gave iron 2 weeks ago. It was like a little red bag.
Oh, no, it's not that interesting.
I thought somebody did. Or maybe I just saw it in the fridge. They're not this big. That would be somebody in the ICU not doing so hot. But they're just little 100 milliliter bags, and we do give them throughout a hospital, say if someone's having some pancreatic issue that they just need a little extra help with, okay? What is the most common side effect of PO iron?
Black poop.
Black tarry stools, right? So please tell your patient, you know, if you have black tarry stools, please don't be calling the doctor. You're fine. You're not going to die. It's all good. We already talked about this one. We'll still move it. All right. Second type of anemia, megaloblastic anemia. What is the difference between just a regular normal cell, red blood cell, and megaloblastic anemia cell?
Bigger.
I haven't had a Diet Coke since last Wednesday. I'll be buzzing off the walls by the time class is over. Exactly. Megaloblastic anemia, you have an enlarged cell. So just think about the cells going through those little tiny veins and arteries. What is one of your main concerns right now?
Clotting.
Clotting. They already like to stick together, and now they're much bigger. So now they're sticking together, but taking up a whole lot more space. What are the major deficiencies of megaloblastic anemia? What is the cell typically missing?
B12.
And
Folic acid.
absolutely. All right. You don't know. That's just vitamin B12. That's okay. Don't confuse it on the test. It's just B12. Okay. Just don't want you to confuse. So B12 deficiency anemia. So the protein secretion secreted partially by the cells by the gastric mucosa. It's not being secreted properly. So it's not being absorbed properly. So they have enough B12 in their system. It's just that the red blood cells aren't recognizing them as much. Okay, so they're hanging out and floating around, but they're not doing any good to you because they're not being transported correctly. So, your etiology. Most commonly caused by what kind of anemia?
Megaloblast.
Hmm?
This epigency is megaloblast.
Or the word etiology.
I was gonna say, isn't it?
Promiscuous?
Pernicious.
It's not the same thing. Pernicious anemia. So that's just typically what's caused by it. What are there some physical restraints that might cause this deficiency? It's a B12 deficiency.
Tapeworm.
What?
You said what causes B12
GI
deficiency?
surgery.
Yeah.
Oh, I'm
Chronic
looking at the
diseases of
B12
the GI
deficiency.
tract.
I'm not looking at that.
Chronic alcoholics, long-term use of histamine receptor blockers and proton pump inhibitors, and strict vegetarian.
This is actually a big problem with vegans. They get this really, really easily, okay? Because their iron count isn't as much. Having a couple cups of spinach, you would have to have, I think the servings are absolutely ridiculous, 20 or 30 servings a day to equal like an 6 ounce piece of red meat. So this is a big deal. So a lot of vegans, like true vegans, actually take a lot of supplements just so this doesn't occur with them. And they have a couple other things that they take. I have a couple friends that are real strict vegans, and they do take a lot of supplements.
The B12 shot in the butt.
I like a good B12 shot.
Oh.
We get at the mall.
So why would you have a deficiency if you had tapeworm?
Because it's eating all your nutrients.
Because it's eating everything.
I was reading the causes of a B12 deficiency.
That's okay.
People do.
You could technically put that under chronic disease of GI tract if you didn't know for the longest time that you had tapeworm. Chronic alcoholics, pancreas is starting to shut down. Okay, the pancreas is not working adequately, so it's not releasing what it needs to release. Just a simple breakdown. Because if the GI tract can't absorb the B12, it can't go to the pancreas, so it can't go out to the red blood cells from the pancreas. So the GI tract is a it's a very common issue when you have a problem with your GI tract. All right, what does your patient look like?
Numb.
They're
Not
numb.
Energy, because it's
Oh, yeah.
B12.
What else?
Cognitive decline.
Okay.
Hypothyroidism.
Okay. So this is,
I
Brittany was
forgot
asking me
one.
earlier, how do you study? You need to take, there's multiple different anemias in the slides. You need to take the manifestations, the rare ones. Every single person's going to have fatigue. Every single person's going to have low energy. What are the specific ones to that particular disease?
No,
Hypothyroid.
so something specific.
Infertility.
Infertility is very specific when it comes to this.
Numbness.
Numbness, depression, everybody has. Depression, let me tell you, nausea, vomiting, fatigue, depression, everybody's got that. Never going to be an answer on the test because everybody's got that, and it holds a whole gamut of disease processes and stuff going on. All right, you need to focus on the real rare ones that you're going to see. All right, diagnostic study. So again, blood tests. In this case, they're going to have to do a smear in the lab with the red blood cells. Because if you just do a regular RBC count, it's just going to count the RBCs. So the RBC count's going to be lower because the cells are bigger, but it's not going to tell you anything. So they have to do a smear just to see what the RBC actually looks like. It's all very interesting. You're also, your vitamin B12 levels are going to be decreased. That just makes sense, right? You don't have as much going on, you don't have as much being absorbed to the GI tract, so the GI tract can't send it to the pancreas, so the pancreas can't put it in the RBCs, okay? The little train gets broken down. All right, collaborative care. Has anybody ever gotten a B12 shot?
Yes.
I highly recommend them. Just personally, it has nothing to do with this class. I just think they're great.
Why?
Just go to the mall.
Yes, you can go to the mall. Is this
Yeah.
what Regency?
Yeah?
Yeah.
No?
No.
Which
Or maybe at Gurney?
They had them at Regency
They
for a long
just
time.
shut it down?
Yeah,
Okay, I
they
get.
kicked all the like little stores out.
Yeah, they kicked out the
somebody
eyebrow place.
A new company took the Regency Mall over and they shut a bunch of little stores. They were completely regulated though. I called the state before I went and had the shot. It was like 20 or 25 bucks a shot. Vitamin B12 is a natural immune agent, so it helps boost your immune system. So like when you first get it, you go on this tiny little immune high and you feel great for like a week. But you can get it in pill form. I take little chewy tablets that I get from GMC. They're gummy.
Isn't it like an energy vitamin too?
I think so. Well, it's a natural
Well,
energy
yeah.
vitamin. So they don't even have to advertise it as an energy vitamin because B12 itself helps boost your immune system, which boosts your energy. So I highly recommend it. Problem is, if you go to your doctor's office, every time you go, they charge you a doctor's visit. All right. That is B12. Any questions?
So there's a black market for B12 shots, maybe somewhere.
Maybe there is a black market. Can I go to folic acid? You want to take a break? Go right to folic acid? What do you want to do? All right, take 10, come back at 2:30. We'll go to folic acid.
See?
Look
Look at how big that is.
What?
That's top notch.
That's your
Like,
bird.
now
It
it's recording.
was recording.
Oh, she has it.
It's huge on here.
That's funny.
My waves are like,
And then there was Shakoya's laugh.
My life is amazing.
I'm contemplating if I should keep that or
Folic
not.
acid deficiency, which is also caused by megaloblastemia, right? What are common causes of folic acid deficiency?
Deficient folic acid.
Dietary.
I don't know.
If they do drugs.
Drugs.
Yep.
If your body needs more of it.
Why would you need an increased requirement of folic acid?
Because you're pregnant.
What is you're pregnant? There you go.
And then.
Because what does folic acid prevent in pregnancy to the baby?
Spina bifida.
Spina bifida. Very good.
So decreased folic acid means that you're pregnant?
No, it. Okay. No, when you are pregnant, you need to increase your folic acid because the baby sucks it out of you. And if you have too little folic acid, it can cause spinal bifida in a newborn.
I don't know if I can believe man, they're selfish.
More and more we learn about
They're
it.
selfish for the rest of their
Existence.
Let me tell you, and they don't have any concept of what time it is either.
Well, you
3,
hope if you're
4,
there
5 in
to
the morning.
deal with it
If
later.
they're up, you're up. Not what we're talking about though in here too. Does anybody know anything about methotrexate?
About what?
Methotrexate.
Like meth?
Meth, no, not meth.
Oh.
If you or a loved
Methotrexate.
one has been affected by methotrexate, please contact our law firm.
That's why I see. That's what I see.
No, it's methotrexate.
No, that's something else. This is methotrexate. This is a drug that is that we give people to treat RA. Completely legal drug. Does a great job of treating RA, by the way. And we'll get into more methotrexate later in the semester. But what methotrexate does is it blocks the absorption of normal folic acid. So if you have someone on methotrexate, I can guarantee their folic acid count is going to be lower, and they're walking right into megaloblastic anemia. So what do you need to do? They have to be on methotrexate. It's one of the only drugs we have out there that treats RA. But this is the most common side effect.
Already
Folic
rheumatoid
Arthritis.
arthritis.
Folic
Oh.
acid supplements.
Folic acid supplements.
This is off topic, but
That's okay.
metformin it does at the B12. So when you're taking metformin,
Sorry.
they give you B12.
You're
Oh,
gonna
there you go.
fall, Teresa.
No, I'm not.
All right. What is your nursing collaboration management?
Early detection.
Early detection.
Ensure safety
How do you ensure safety?
by detecting it
Very good.
Good answer. Good. What happens though when you have the megaloblastic anemia? What happens to their fingertips and their palms?
Oh, they're numb.
They get numb.
Oh, because of the
So tell them to
heat. So
check
just make
themselves.
sure that they're being careful.
Exactly. So the sensation to heat and pain is decreased. They can't feel as well. So when it comes to ensuring safety, they need to have some sort of safety plan. Most people, the safety plan is pretty mundane. I don't know about any of you guys in here, but I'm a big bath taker. I have like a big old like soaker tub. And if you have a person that loves to take baths, but they can't detect how hot the water is, what are some things that can be done?
A thermometer.
A thermometer,
Baby,
absolutely.
yeah.
What?
They have
Do it.
baby thermometers.
Like
Like
The
really
baby,
nice.
like we have the little
cards.
rubber ducky
Or
that
simply
if the
just
water's
have
too hot, just as
somebody
hot.
who
Take a
will
bath.
test the water. Be like, this is way too You hot.
can actually turn down your temperature on your hot water.
Ah, then you don't have to worry about it.
Oh.
Yes.
Every water heater has a thermometer on it. You can turn the temperature up and down. So if you know that you like your baths at 103, 104, which is pretty typical, you can just set it to 104. That way you can just turn it on, turn it all the way up, and it's not, the temperature's not gonna go over 104, so you're not gonna get burned. Mm-hmm.
Fancy.
Is fancy. Fancy water heaters. Any questions on folic acid?
So you just,
So what are your big takeaways from folic acid?
you do not, are your sensations lost?
Yeah. What else?
Prevention of injury,
Why?
because they have numbness and they can't feel if they're injured.
Good. What else? What's the drug we talked about?
Methotrexate.
Okay. All right. All right. Aplastic anemia. What does aplastic anemia come from? Why do we get it?
Pancytopenia.
Is that?
A decrease in all blood cells.
Yeah. Why do we get it?
Bleeding?
Trauma. Pancytopenia.
Cytopenia.
Hmm?
Cytopenia.
There's a lack of them, so they're not
Is
being
that
produced
first word?
because it's genetic.
It's a disease in which the patient has a decrease of peripheral blood flow. People typically get it, they're typically born with it. You can acquire it, but it is much more rare to acquire it. And it typically comes from an autoimmune base. Right, what are your signs and symptoms?
Oh, that's small.
All sorts of stuff, lethargy, fatigue.
All right, pick out the ones that are you've never heard of before. Do that.
Neutropenia.
Okay, what's neutropenia?
No idea.
Neutropenic, that's when you've been, you can't go into the room because their level.
When there are patients under neutropenic precaution is when their white blood cell counts are dangerously low or non-existent. Typically, what kind of patients do we see this in? Cancer patients getting treated with chemo and radiation. That is where we typically see it in. So if you have a patient that has aplastic anemia, they're under neutropenic precautions, what is the first sign that they have an infection going on? Fever, very good. Because your white blood cell count's non-existent, so you can look at that all you want, it's not going to be there. So how often is this patient getting vital signs on?
3 hours?
A minimum of 4 hours, a few 4 hours.
So you want to check their vitals every 4 hours, minimum?
Oh, yes, minimum of 4 hours.
Okay.
The temperature might be the only sign that there's an infection process going on. They might not have the normal signs. The chills, the sweatiness. Okay, so this is why it's so important. So it's also important if you have a CNA or someone that says they took the vitals and everyone did and just made them up. But yeah, that happens.
So funny, I was just saying that the other day.
Diagnostic studies. So aplastic anemia, diagnostic studies, what are we going to be running? What's that doctor going to be looking at?
WBCs.
And they're going to have a low hemoglobin.
And platelet.
Platelets are going to be on the low side. They're not going to be critical, but they're going to be on the low side.
Retic count,
All right, what is a reticulocyte cell?
is that for kidneys? Liver, function,
Isn't that an undeveloped?
Very good. It's an undeveloped RBC. So why would you have a whole bunch of undeveloped RBCs?
I know,
Low H&H.
Not typically low in H&H.
Maybe because they didn't have enough.
There's usually a trauma event if you have a whole bunch of reticulocytes. It's completely normal to have a couple thousand, but I mean like tens and hundreds of thousands. So where does the RBCs come from? Bone marrow?
Bone marrow.
Bone marrow, good.
Oh gosh.
So where's your bone marrow located? Okay, so if you break a bone,
oh,
what's going to happen to that reticulocyte count?
Increases.
Boom, it's gonna go up. Because all of a sudden, it's released all those unmature cells, okay? We see it all the time in surgery when someone broke a bone or we broke a bone for them. Their reticulocyte counts would shoot up for a couple days. It's completely normal. They're gonna die out a lot faster because they're not strong. And then the pancreas and the bone marrow are gonna take over and make some money.
Die out as in like the spleen will.
Yeah, the spleen will go take them out.
Okay.
We'll filter them out. And then where's the iron go from those undeveloped RBCs?
Right back to the bone marrow.
Right back to the bone marrow. See, kind of makes sense. All right. So what is one of the biggest risk factors of someone with aplastic anemia? The low blood white cell counts. What's their big risk factor? Infection. So what kind of people would you not want this patient around?
Sick people. old
Anybody in the
people.
hospital?
Just stay out of the hospital. Thank you. Tell people all the time it's disgusting in the hospital. Don't go unless you have to.
Kid? No.
Kids.
Kids, stay away from them.
Older people?
Kids are a monopoly, and I was always told this, but I did not experience it until we got sole custody of my stepdaughter, who I believe has been ill since the second week of school, and just keeps getting the three of us sick. I'm sick again. I was fine, I'm sick again. Kids, or anybody see that nurse video from Florida? The nurse that was in Lakeland that went off one night after a 12-hour shift because all these people are coming with the flu and the basketball team, baseball team, whatever. Hospitals are absolutely disgusting, ridiculously disgusting. And I almost threw up once when I saw like a little 6-month-old baby on the floor because the mom thought it would be, thought everyone thinks the hospital's clean. Oh my God, it's not clean. Everyone that's sick goes to the hospital. It's not clean.
Especially the floor.
No,
You don't
Oh.
necessarily walk in. Or the parents that let their kids run around with no shoes and socks on in the hospital. I'm like, what are you doing?
Like, oh my God,
My
baseball.
son do that in the gym in the
Oh,
locker
it's so
room.
gross.
I feel bad.
I know there are some cases where you need to go see somebody and you have your children and you can't. I totally understand. I get that. But make it short, make it sweet, because not only are you putting little ones at risk factors, you're putting anybody with an immune compromised system, or those little germ infested little people. Yes, they are germ infested. I have a daughter now, I can say that. They go anywhere near those rooms, they sneeze on a box of Kleenex that's closed, so it's unbeknownst to you that anybody touched it. You bring it into an immune compromised cancer patient, you just gave that patient those germs. You could have just killed your patient. And people don't process, I don't think a lot of people process the way nurses process stuff though. Stay in the hospital. All right, acute blood loss. What is some common factors of getting acute blood loss?
Motor vehicle accident.
Motor vehicle accident, very good. So any type of trauma. And remember, acute blood loss can be both internal or external or both. So you might not be able to see it right away. Like a baseball bat to someone's abdomen. What else?
Pregnancy, surgery.
Surgery is a big one. Big abdomen surgeries, big CV surgeries. You're going to have a very small amount of time with very rapid loss of blood. It's completely normal. So, you can read your manifestations. This is just the chart. It's very stimulating. It really is.
We need to memorize that.
No?
We need to memorize the chart.
I hope not. I've never memorized that chart. Yeah. All right, but diagnostic studies. So again, what are you going to do?
Lab.
What kind?
CBC.
Yes, UBC. It's going to show your RBC count, your hemoglobin, your platelets. It is very normal to take someone into a surgery and do a CBC before they go, and everything completely normal. And then a couple hours into the surgery, we do a CBC count, and everything dropped, like their hemoglobin dropped, their hematocrit dropped, their red blood cells count dropped, their platelets dropped, and there's barely been any blood loss.
But they're cut open.
What's happened? Nope. What's happening to the patient?
Shot.
Nope.
Respiratory depression.
No, they're fine.
They're clotting.
Patients? Nope. They were dehydrated. We gave them 3 liters of fluid. They're hydrated. They were anemic to start and we didn't know it. Now we have to give them some blood. Okay? It happens all the time. So, typical 5 liters, right? Fairly typical. Kind of depends on the person. My husband's about 8 inches taller than me. He probably has a higher amount of volume, blood in his system just because he's bigger. But it's pretty typical. So, how much blood can you typically lose before you go into shock?
500 cc's.
You can lose 500 cc's without blinking, you'll be fine.
Oh gosh.
2 liters.
3 liters, you will go into shock. At this point, you need to give them blood and you need to do it rapidly. So what do you do if you don't have blood on hand?
Cut yourself open and just.
Just start
Normal saline until you can get blood, huh?
normal saline or lactated ringers until you get the blood in. What is the blood everybody can get? O and egg, very good, okay. So this is why you ever see a MASH unit. We were watching MASH the other night because there was like nothing else on. The Olympics were kind of boring. And they are constantly asking for O and egg, okay? Because everybody can get it. In the hospital setting, if you were in the emergency room, you should have time to get a cross match done. They can rapidly do it in about 15 to 20 minutes to get the correct blood, but there are cases where you need the O and egg blood or your patient only has a couple minutes, okay? Chronic blood loss. What are examples of chronic blood loss?
Bleeding ulcer.
Bleeding ulcer.
Like fire patients, burn patients?
Burn patients, yep. What else? Menstrual cycle. Any question on chronic blood loss? That was the only slide on chronic blood loss. I'll make sure we got it. Okay. All right. Hemolytic anemia. What is hemolytic anemia?
Destruction.
Destruction of.
Red blood cells.
Very good. Did you ever know that?
Nope.
What are the causes?
Caused by problems incentric or eccentric to the red blood cells.
Yes, but do you know the difference between intrinsic and
No.
extrinsic?
Well, N is probably internal and X is something.
One is internal, one is external.
Okay.
One is causing inside, and one is from the outside, okay? All right, so anemia. Again, what is the symptoms that are different from the other anemias? There's a lot of anemias in this PowerPoint slides.
Fainting.
Spleen enlargement.
Spleen enlargement. What's the other one?
Yellowing.
Jaundice.
Jaundice.
Muscle pain.
Change in stool color.
Change in stool color. There's another one like
was
that,
on
but
another
it is more
Heart
specific.
attack.
Internal was on the other one.
There's another one with heart attack.
Muscle pain.
Muscle pain. It's very rare to get muscle pain other than this one. This is something that's much harder to fix. If you have a deficiency in iron, we give you iron. If you have a deficiency in B12, we give you B12. Folic acid, we give you folic acid, right? How do you fix something like this? Why does somebody get this?
Trauma? Or no, that's something.
Maybe because the spleen is just taking out too much.
Chronic kidney disease.
Ah,
Oh, it's right there.
chronic kidney disease, renal function. So how do you fix this?
Fix the kidney.
You can't fix the kidneys, but you can maintain the kidney function by dialysis, by certain treatments. This is a patient that's going to need a lot of rest in their life. Okay, this is the care plan patient where they can take naps. Because this type of patient is not going to be able to push through fatigue. You're nursing students. A lot of you work at the hospitals. You know how to push through when you're tired. This particular person, it's not a possibility. They try to push through, what's going to happen?
Pass out.
They'll pass out. Okay? They don't have the immune system to deal with this. All right, let's talk about sickle cell. What do you know about sickle cell?
Abnormal.
It sucks.
Is it
Yes,
most
it
common
does.
in African Americans?
It is dominant in African Americans.
Autism, it's inherited.
Very painful.
Yes, it is. You can't catch this. It's given to you. I had a beautiful young lady orientating with me that had a much nicer tan than I did. And unfortunately, she didn't know much about sickle cell, and she was terrified that the patient that had sickle cell would give it to her because she was African American. We had to go do some education. So, she was the sweetest thing, though. And she's a good nurse. She just didn't know anything about sickle cell. What else do you know about it? It is ridiculously painful. Why is it so painful?
Oh, because like shards of glass are just floating through.
Pretty much.
What? Say that again?
I said shards of glass are basically just floating through your bloodstream.
So your normal hemoglobin, they're nice little oval cells, right? And they like to stick together, but for the most part, they like to bounce off each other. It's like they're constantly playing catch each other. When it comes to sickle cell cells, they're more like a boomerang shape. So what do you guys know about boomerangs?
They come back.
But what do they look like?
Like bananas.
So if you have two normal cells, they're bouncing off each other. You have two,
They could be
Boomerang
hooked on each
cells.
other and hooked on each
they'll
other.
hook each other, hook each other, hook each other, hook each other.
And then
Why
clap,
is
clap,
it
clap.
so painful though?
Blocks blood flow.
It blocks blood flow, which blocks oxygen flow.
Are they in constant pain or is it?
No, it's usually just during crisis.
Oh,
Like episodes.
And it is a crisis. So a normal, this is a normal cell on the left. You guys see that okay?
Mhm.
Back there? Okay. An oxygenated sickle cell doesn't look half bad, right? Still not the best, but it's a lot better than the deoxygenated sickle cell. Agreed? So why is the first thing we do during a crisis pain control?
So that they can breathe better.
Yeah.
Sorry.
You've got to get the pain under control. Yes, as soon as you give them pain medication, you are going to simultaneously put some oxygen on them. When it came to sickle cell patients, I would put a non-rebreather 10 liters on immediately. I don't care if I had an order or not. Okay? If they didn't need the O2, no one besides a COPD patient ever died from having too much oxygen. And how do you know if they have COPD? Oh my gosh, just ask them. You got any respiratory issues, COPD? No? Okay, cool. Boom. You don't have much time. Yes, ma'am.
Would an episode come from them like having obstruction of breathing, or is it just happens on its own?
It
because of no
typically
reason?
happens after either a dehydration period, because the less volume you have, the easier it is for those little guys to stick together, or a lot of physical exercise. Anybody, okay, this is going to age me a little bit. A TLC?
Yes.
She would chronically go into sickle cell crisis after a couple days of shows. You're constantly moving on stage. What? T-Bass. What was her real name? It was a pretty name. I don't remember. I'll look it up later. She was constantly up on stage. They're dancing, they're moving, they're singing. A lot of physical exertion. Well, with that comes a lot of dehydration. So she would constantly be in sickle cell crisis when they were on tour. There was multiple times where she had to be admitted to the hospital for pain management. So, and the only reason I know this, I actually read a book about them when I was sick one day. I was on my iPad. And what they ended up doing for tours was they would space it out. They would do a show and then not do another show for like 3 days. And because, I mean, virtually you will end up dying from sickle cell crisis if you can't get it under control. So what's the first intervention you should do?
pain control.
Pain.
Absolutely.
Then hydrate.
Then oxygen, then hydrate. Because you can throw an IV in, give 10 of morphine, hook up the oxygen, put a line in a matter of a minute and a half. No problems.
So it should be PO instead of hot.
It really should be PO, but for whatever reason they classify it as hot. Whatever. Just reverse it. Alright, your minute clinical manifestations. What's the patient gonna look like? Other than pain.
Jaundice or no?
I don't think so.
We
It
just
says
talked-
jaundice from.
Paler.
Oh, okay.
Harold, what does it say in there?
Priapism.
Priapism.
What does that mean?
Boner.
What? You have an erection for more than 4 hours. Please call your medical physician.
It's a boner.
That can happen to you.
That is a medical emergency.
Oh.
Because
yeah,
after
so
that 4-hour-ish mark, the tissue can start to break down. That's why it's
That's all
No,
it's like.
we had a patient come in and we drained him because it's a normal thing for him and he still has to get the surgery. But I walked in the room and it was 6 hours. He goes, "Oh, thank God you're here!" And immediately it went down. I'm like, I don't know if it's a good or a bad thing, but I'll take it. That was bad. I was. They called me boner killer for a long time.
the stories, the ER stories.
Yeah.
Okay. All right, complications. What are complications of sickle cell anemia?
Blood clots.
Blood clots, absolutely.
Yeah, having your attacks.
What's that?
Having the constant attacks, or is that not?
The crisis?
Yeah,
crisis?
crises.
What's the complications of the crisis?
Not enough oxygen.
Not enough oxygen?
Infections?
Pneumonia
Infections?
is common.
Ulcers? Mind ulcers?
What happens to the spleen after constant?
It can rupture.
Shut down?
It will slowly shut down. Why is it slowly shutting down? What's going on with the spleen when it comes to sickle cell crisis? Does the spleen get larger or smaller?
Smaller.
It gets smaller. Do you know why?
So it's not getting the blood flow.
Because of the scarring that happens during the attacks. Your pancreas, the spleen is scarring. So it will slowly start to get smaller and smaller. It's called autosplenectomy. When it comes to these patients too, when it comes to infection, they are highly, highly susceptible to infections. Do you know why?
Sickle cell is also highly for infection. I don't know how
Yeah.
to say that.
Sickle
Okay.
cell anemia, the individual is highly susceptible for infections. Think about the way the cell looks. Is that cell transporting nutrients and oxygens correctly? No. So the patient's under this is an autoimmune issue. So the patient is highly susceptible to infection. So after someone leaves the hospital in a crisis, and it's gotten better, but technically a crisis can last up to 2 weeks after they're first admitted, okay? It doesn't magically just go away, when the cells don't magically just go back to a normal state for them. They absolutely need to avoid what?
Exercise.
No,
Sick people?
sick people. So where are sick people hang out?
Hospital?
Yeah, don't please leave the hospital. Where else? Just think of some place you would go that has just a lot of people.
Subway.
The
The
mall.
mall, the movie theater,
The subway.
the stores. They need to kind of stay away from the general public for a little bit, okay?
I know it's gross, but I feel
When,
like I like to do
all right,
this.
come back to me.
Okay, but.
When my
there's
little
some
brother-
chicken
What's wrong?
I said Chuck E. Cheese, sorry.
Oh yeah, don't ever go to Chuck E.
Little-
Cheese. Just
little
stop right now.
Sundays,
Just,
those-
I'll write you an order. Never. Okay. When my little brother first finally left the hospital after about 5 to 6 months of leukemia treatment, his friend decided to take him grocery shopping and take him to the movies. Wanted to kill both of them. And when I finally found out where they were, because they were in a movie theater, so their phones were off, his friend was like, "Well, I didn't realize he was doing anything wrong." Well, his white blood cell count was non-existent. Of course, it has nothing to do with sickle cell anemia, but regardless, the same concept. You took him to 2 disgusting places. You might as well just go back to the hospital. Okay? I was livid. Alright, the best test we do for sickle cell anemia, again, is a smear. The only time you can see those nice boomerang cells is to do a smear, alright? There's other things we can do to see how advanced the sickle cell is, but we really can tell just by doing an x-ray of what? What did we just talk about that gets smaller?
Oh, the spleen.
The spleen's getting smaller, we know that this is more advanced.
Would you find this more as a kid, or this could happen?
What's gonna happen to adults? I've had adults come to the ER with generalized horrible pain and they're in sickle cell crisis and never knew they had sickle
So
cell.
it develops, or they could have been having it since
They
were
can just be a
tiny?
carrier,
Okay.
and people can be carriers and never get it,
Mhm.
but then they give it to their children.
Oh yeah.
Yeah, it's a rough little disease. So what are some other, what other management treatments can an individual get that has sickle cell disease? Just a standard sickle cell disease, what can they get done?
Hydrate.
They need to stay hydrated.
Pain management?
Well, hopefully just a regular, just everyday sickle cell, they're not in any pain.
Nauseous.
Involve rest.
Involve rest.
Take folic acid on a regular,
Why?
because it says it.
But why?
Because it's a
'Cause you're
nutrient that the
insufficient.
blood cells
What?
It's a nutrient that the blood cells need.
It helps pump up the blood cell. It helps make that blood cell a little more oval. What about the infections? What can somebody do?
Stay away from
Take vitamin
Wear
C.
masks.
Vitamins, they take vitamins, they can wear a mask. What
Wash
other
your
thing can they
hands.
possibly do that you all had to get done before you go to your
Flu
clinical site?
vaccination.
The flu vaccination, the pneumonia vaccination. Obviously, it's completely up to them. You can't force a vaccination on anybody, but it is a highly recommendable thing. Okay. And just I would tell people just the big ones. The flu vaccination, which has worked so well this season. The pneumonia vaccination and the hepatitis series. Listen, the hepatitis series has been around about 4 decades and has very minimal side effects. I would just personally tell people just the big ones. Like, you know, don't be going and getting like all this other crazy vaccinations that we give little people. It's not gonna help.
So, question real quick.
Yes, ma'am.
So there's sickle cell trait and then sickle cell disease, right?
Yes.
The trait, basically, you don't have any symptoms until you go into crisis.
Right. Like basically that means you're just a carrier until either you pass it on to your children or something happens in the body, the spleen cues the crisis.
Because that's where, like, all the college athletes all of a sudden were dying from it, right?
Right, exactly. And you can go decades without having it done and never know. Because how often are you going, oh, let me go have a smear of my RBC's done. I'll be fine, okay. Are you guys good?
Mm-hmm.
All right. Polycythemia vera. What is this? Any too much of red blood cells. Very good. Body's going a little bit crazy, and they're making too many red blood cells. And the spleen just having a party. All right. What are your symptoms?
Pain.
Double vision.
Double vision. What else?
Pain in the big toe.
Pain in the big toe, the joints, the big toe. Okay, very specific, right? What are our Yes, sir.
I have a question. So how does it work with athletes that do blood doping then? How are they not affected?
I don't know. I don't even know what blood doping is. I'm going to have to Google that.
Lance
Lance
Armstrong.
He would have his blood taken and then have it retransfused so that he had more oxygen.
He would just
Well,
add,
celebrities
he
do
would
that.
auto-
he added
infuse.
more blood to
Yeah.
himself, so he'd have more oxygen consumption when
Good.
he's. But the only reason it works is because they're out there working and pumping, so it's not like they're sitting there resting.
I guess that makes sense.
Because I mean, you're talking about he's going thousands,
Yeah.
hundreds of miles.
He got
off
all
the
those
flight.
titles
No,
and
steroids to keep
So
him
blood
out.
doping is against the rules. It's your own, whatever.
That's-
No. Well, I'm not smart.
The whole Russian
No.
country was banned from the Olympics because of doping. All right, your diagnostic tests. Same thing as all the others, okay? Not much of a difference when it comes to that. All right. Collaborative care and management.
Avoid iron supplements.
Yes. You have enough,
Oh yeah.
okay? This is an increase of RBCs. You got plenty. What are some things? Yes, ma'am?
So then if you want to avoid too much iron, would you have to like alter the diet?
No, not really.
Don't eat 5 steaks a day.
Yeah, there you go. No more steaks every day for you.
Sorry, Trish.
What are some things you can do?
Hydration.
You need to hydrate, but you shouldn't go into a fluid overload. Some individuals will just go a little bit crazy on the water. Does anybody know the recommended amount of water an individual will take for a day? And it's different, it's different for
3,000 to
everybody.
Oh
Not
yeah,
for
based
body
on
weight.
it's based on your body.
It is
weight.
based on your body weight.
But the BMI scale sucks.
Don't even look at the BMI scale. We
No,
don't
it's
even
actually
teach off the BMI scale anymore. Because a BMI of 25, I would look like a skeleton. Even in my best shape when I was a senior in high school, I was not what I was supposed to be for the quote BMI. My husband's 6'3" and he only weighs 200 pounds. He went to the doctor's office for a checkup. Technically, he's overweight.
What?
Me too.
Don't get me started on that.
So we don't. Nobody that I know does anything with the BMI anymore. I don't know one physician. It's on the paperwork, but nobody cares about it
Maybe
anymore.
just measures you now.
Yeah, it's stupid. All right, but you don't want to go into fluid volume overload because you already have a lot of cells. But you need to stay hydrated. Anybody know the recommendation from the FDA?
8 gallon of water?
It's half
For-
your body weight now.
It's half your body weight in ounces. So if you weigh 200 pounds, you should be drinking 100 ounces of water a day.
Not tequila.
That sounds like a lot, but really it's not. It's really not.
Question.
Yes.
Would you drain your blood? Like
It won't matter because what's going on is the pancreas and the bone marrow just kicking out more red blood cells than they need.
Okay.
So in the long
It
run,
would
it's
just
not gonna
happen.
matter.
Okay.
So low dose aspirin. Why do you want them on a low dose aspirin?
Because you don't want quantity.
Right, just gonna help the RBCs stay a little bit slick.
ASA is aspirin.
ASA is aspirin, yes.
You mean slick?
Not sticky.
They're not sticking together. They're bouncing off each other a little bit more.
Okay.
Like you put grease on the outside of them. When it comes to the management, this is not something we can fix. You can see the drug up there. That is the only drug that is known that can help the RBCs not be stimulated as much. It inhibits. What am I trying to say? It inhibits the RBCs from maturing. There you go. So they die off faster. That makes sense. Like what's an immature RBC? Reticulocyte. So you're going to have a higher count of reticulocytes if you're on this drug and have this disease. Completely
And
normal.
that's the Jacobite.
Yeah, that Jacobite thing. There is a couple medications, but that is the most commonly used. It's used like over 90% of the time. Any questions there? All right, let's go to something everybody always seems to know about. DVT, your deep vein thrombosis. What is DVT?
Deep vein thrombosis.
And why do we care about it?
It can go to your lungs, your heart, or your
It's like
anything.
Can turn into PT. What else can it, PE? What else can it turn into?
One up here.
Go up to the brain for stroke. So if you have somebody admitted into the hospital and they think the patient has a DVT, so they're running a couple tests, they're going to do an ultrasound, they're going to make sure what's going on, and all of a sudden they're unresponsive. Possibly have a stroke. What's the first thing you need to do?
Jumbo.
Take a pulse.
Check blood.
CT, get the code team.
Oh my God, guys, get the physician on board.
Oxygen.
You need to get the physician on board. When it comes to someone that's immediately unresponsive, because other than oxygen, you can't do anything else. You need a stat CT, and you can't do that on your own. Now I will tell you, Trish works in the ER. I don't know if she's seen this. Myself, and I've had dozens of nurses I know. You all of a sudden you have somebody that you think they had a DVT, and all of a sudden they're unresponsive. We will be running with the patient on the cart to CT scan and tell our physician to put the order in.
That's
Yeah.
They won't argue at all.
Well, they'll just throw in.
They'll be like, whatever, let me know how it goes, and they'll just move on with their life. If the patient all of a sudden cannot breathe,
Chest tube.
what?
Chest tube.
No, they had a DVT, and all of a sudden they can't breathe. Probably has PE, so get some oxygen on, call who?
Respiratory.
No, respiratory's not gonna do anything.
Doctor.
You need to call that doctor. This patient needs a certain medication,
It needs
heparin, they need IV heparin. Because you cannot fix the PE, it has to dissolve. But you need to stop it from growing, okay? And what's the lab with heparin? And what's the lab with Coumadin? Good job. All right, you can read your etiology.
Oh, we already had this slide.
Heparin is PTT. Any questions on DVTs? All right, to thrombocytopenia we go. What is thrombocytopenia?
Not enough plate.
You are correct, not enough platelets. So in this case, somebody that has a platelet count of 150 or less has thrombocytopenia. Now, you can have a platelet count of 150 or less because something happened. You had a trauma, you had a surgery, you recovered, it went to normal. In this case, when it comes to thrombocytopenia, this is someone that you could treat them all day long and nothing's going to change. Okay? So, what are your causes?
Inherited.
It is inherited.
Acquired.
How do you get acquired?
Always get these questions. Well, your immune
Mhm.
system. Picking it up.
The biggest acquiration of thrombocytopenia is heparin-induced thrombocytopenia, and we'll get there in a second, okay? That's the biggest one that you'll see. Your signs and symptoms. What are your signs and symptoms? Other than just doing a CBC and seeing that their platelet counts are too low.
Bruising. Bleeding.
Bleeding.
Bleeding. Petechiae. Microhemorrhaging. Good.
Bruises.
PERPA. What is
Stages.
PERPA?
Bruises from
The bruises. The petechiae are basically growing, and now you have bruises. And what's the last one?
Large lesion.
All right. Ecchymosis. Large lesions from the hemorrhage. Basically, you start small. Depending on which sign they have is depending on how far advanced they are. All right. Prolonged bleeding after routine procedures. So what would be a routine procedure?
Maybe
That's a good one.
wisdom teeth or something.
Okay.
Does it say it on
If you have, what's that?
A glucose check.
A glucose check. Perfect. If you have somebody with sarcopenia and let's say they have to do their wisdom teeth pulled, they need to cancel that until their platelet counts are at a average range, because you can get them back to average with some medical treatment, just as a precautionary measure. You know, if they absolutely don't need it done, to me that would be an elective thing. I know it can impact and be painful, but if they can wait a week or two, it would be better off for them. And I'm telling you, I know some great dentists and some great oral surgeons, but if they're nonstop bleeding, they're just going to call 911 to get the patient to the ER. Okay, so they need to wait. In the cases where you can't, platelet drops, the platelets are under 150, but they absolutely have to have surgery. It's not an option. What do we do?
Get a blood transfusion ready?
Blood or what? Because the RBCs could be completely fine. You need platelet counts. I have had patients that are coming back to the OR, we're giving them 5-6 units of platelets. And platelets you can just plug in and run in.
They just infuse them while they're cutting?
Yep.
Okay.
I have gone through dozens and dozens of platelet infusions in a surgery, because without the surgery the patient's going to die, and with the surgery you've got a shot. So that's what we're going to do. You might give a unit of whole blood cells if their RBCs drop a little bit, just that it won't hurt. But platelet count and plasma, platelets and plasma you can throw into the body. You don't need any checks. You can just, you need to check the patient and everything, but the 15 minutes that you do with blood, they do not have that with platelets and plasma. You can spike it and let it flow into gravity.
They sell vitals though, right? No?
I have had platelets going in 2 minutes, a whole unit of platelets. If they're in surgery, they're having constant vitals anyways. But any reaction that the patient could have would be minuscule to what's going on. So, all right. Most physicians will not do anything about the platelet count. If the patient's stable, they don't have crazies going on, other than maybe they have to have a shot, they will not treat the platelet count until it's under 20,000. Seems low, but if the reason they have thrombocytopenia is being fixed, eventually those platelet count will naturally go back up. And the less things you can introduce to your patient, the better. So, but if you had to have a patient that had to have a shot or a glucose, as the nurse, what would you do?
Excess pressure.
Exactly, that's it. Excess pressure when you're done. Does all of these make sense? Your nursing interventions? And you use electric razor. No NSAIDs. Why can't people have NSAIDs that?
It makes your blood thin.
Nope, not NSAIDs.
Because it's an anti-inflammatory. And if they're going to want to clot, then you're going to take away that whole inflammatory response.
Do you guys get that? Aspirin's your clotting agent.
Oh, okay.
NSAIDs can suppress the factor. That, and where does the NSAID break down? In your GI gut. So you're more susceptible to ulcers when you're taking NSAIDs. Even if you've never had one, because the platelet counts are so low, you're more susceptible to an ulcer. If you have to give a shot and you can do it sub-Q, you should do it sub-Q before IM, because your bleeding factor is going to be a lot less in the subcutaneous fat. Why should the patient use lotions, things to moisturize their skin?
So they don't crack.
So they don't crack and bleed. And most of these patients are on stool softeners. All right. Immune thrombocytopenia PURPA. So what does the PURPA mean? What's the patient gonna look like? Bruising, right? Okay. So the same kind of interventions though. Platelet count under 20 to 30,000. Avoid injections. This is fairly the same through these two. Because then the next one's, sorry about that, one more. The next one's thrombotic cytopenia. They're virtually the same. You're not going to have a question on the test that has one versus the other, okay? Your signs and symptoms are almost the same. Your treatments are the same. The only difference is that after a smear, and virtually, I'll be honest with you, as a nurse, I don't care which one they have because the treatments are going to be the same. The doctor is going to care because they're going to know long-term what to do, but at that moment, it's not going to affect how you're treating your patient, okay?
So which one's after the smear?
Any of the thrombocytopenias.
Oh, okay.
Yeah. So, the one that is different though, is heparin-induced thrombocytopenia. This is something that we give to patients. Can you guess which medication induces this? Shocking, I know, right? Okay, so this type of patient will have a heparin infusion going. So what happens is they're on heparin. Something's going on, they have a DVT, they have a blood clot somewhere, they're on their heparin count. All of a sudden their heparin count's completely fine, everything looks great, and their counts drop. And I mean within minutes. What is the first thing you should do? Stop the heparin. I will guarantee they're in heparin-induced thrombocytopenia. They can never go on heparin again. Ever. I don't care if it's a low molecular heparin, they will never go on heparin again because if they do, you will give them DIC and they will die.
DIC.
Isn't that really bad coma?
DIC is horrible.
Is that
When it's
coma?
like clotting and then it's.
It removes your clotting factor of your entire body and the patient will bleed out in a matter of minutes. And there is nothing you can do.
So what's a year ago?
You said DIC?
It's called DIC. I don't care if you know that. That's just what happened.
Fun fact.
Yeah.
That's what I know.
Yeah.
Yeah, Dave talked a lot about it.
I've had 3 patients in my career with DIC and all 3 of them died within an hour. The clotting factor is non-existent, it's gone. And this is one of the reasons. Someone will have heparin, they'll go into heparin-induced thrombocytopenia, and 20 years later you put them on heparin again, and you had no idea, and you just killed them.
So I didn't remember.
Or sometimes the patient is non-lucid.
Unconscious,
They're
yeah.
unconscious, you have no idea. And there's no way, now we can go back to records, I think since 2008 for most hospitals. But back before computerized, there was no way for us to know. If you had someone come in from out of the state, out of the city, this was going on, you just throw them on heparin, that was just the norm. So,
Heparin's like heroin.
I like that.
I was reading your.
I steal
Drawing.
stuff from Pinterest, this from Pinterest.
Whatever you drew that.
Looks like.
No, I could not draw that well. All right, that's it. Any questions? Bless you.
Thank you.
All right,